Go ahead.
Okay, hi there. My name is Dr. Bruce Farrell. I just wanted to share with you or put a shout out to my coach, Eric Vickery, and just share some things that have been helpful for me in my practice and its growth over the last 20 years. Really, one of the big things we did is to start implementing some systems, so we had some continuity. And then just like a team, I coach all sorts of sports, having those systems or those fundamentals in place based upon the culture you want, the type of practice you want, setting some goals, and then, implementing systems so you have that continuity. So, we don't have a lot of staff changes around here, but we do have changes, times change, and it allows us to continue to advance, bring in new technology, but have that base. So that we can continue to speak in the same language to our patient, have the same flow as we meet our patients with new patient exams and everything like that. But we have systems in place that we continue to build upon, and so that's been helpful. Just kind of like when I coached, we had different things that we would implement in week 1 and week 2, but you're constantly revisiting those things by adding new skills. And so that's what's been nice with, as we add new technology, we have those systems so we can add those new skills because we've already have the basics. Another thing that was really nice is just getting us all speaking the same language. So working with Eric's been helpful as far as communication, identifying patients' expectations, identifying patients' personality types, so that you can implement the platinum rule and understanding what the platinum rule is, and then having us all be on board so that we understand patients' emotional level, personality types, and how best to communicate with them. Once you can do that, then it also makes it easier for us to have communications amongst ourselves, because the dentistry is tough, and it's tough on everybody. So when those challenges come up, it's easier if we can all just sit down and speak the same language, so we're talking about apples to apples, oranges to oranges. So yeah, Eric's been really helpful with the systems, with setting the goals, kind of the big picture stuff. But the one nice thing also about Eric is that he's good at the specifics. So not only working on the business, but in the business. So because he's started off working with his father-in-law, and then he's worked in the business in the front office. It's nice to have the specifics when you need them. So yeah, this is great over here, the goal setting, but sometimes I need to know, okay, how do I do this? What should I do? Or do you have this document? Or do you have an idea about this software? And so you can say, yeah, well, actually, I've done that. I've spoken to this patient about that. I've talked about presenting this $50,000 case to a patient. I've done it. I've walked the walk. So that's been nice. So, if I need an Excel spreadsheet on analytics, or if I need, hey, what are some ideas about presenting, this comprehensive case, with CR bite and, occlusal adjustment, some of these things that are a little different. What are some approaches? He's good with the specifics. So, I appreciate having that person that I can tap on sometimes when I just, need an answer, a direct answer. So, if you have any questions, feel free to contact me. I just want to put a shout out to Eric. So thanks for all you've done, and thank you.